Hello and welcome to our brown bag webinar on Arizona Youth Survey Substance Awareness Coalition's dashboard. My name is Jason Trask. I would like to thank the Bureau of Justice Statistics before we get started for their support. Their support makes webinars like this possible. Every 2 years, the Arizona Statistical Analysis Center, in partnership with the Arizona State University School of Criminology and Criminal Justice, administers the Arizona Youth Survey to a statewide sample of 8th, 10th, and 12th graders. The survey assesses prevalence and frequency of youth substance use, gang involvement, and other risky behaviors, as well as risk and protective factors correlated with these behaviors. To better serve Arizona's substance awareness coalitions, the Arizona SAC has developed a coalition-specific dashboard to go along with the survey. This tool allows the coalitions to easily query, view, and create customized reports with data specific to youth in their communities. With all that being said, I will turn things over to Dr. Allison Horgan and Matt Bolesky for a brief overview of the survey and a demonstration of the new dashboard.
Great, thank you, Jason. I'm Allison Horgan. I'm the SAC director at the Arizona Criminal Justice Commission. Matt, did you want to do introductions now?
Sure. Matt Bolesky, I'm the Assistant Director of Programs at the Arizona Criminal Justice Commission, and here to talk a little bit more on the technical side of our dashboards.
Great. So I'm just going to give a pretty brief overview of the survey itself and kind of what led us to develop these tools, and then let Matt take over on the technical side of things. So as Jason said in his introduction, yeah, thanks, Matt. We do administer the Arizona Youth Survey every 2 years as part of our state statute mandated requirements. And we do this in partnership with Arizona State University. It is given to 8th, 10th, and 12th grade students across the state. We have also administered to some other grades, 7th and 9th graders, but not as regularly. So we have opened up the sample a little bit in previous years. We only have 15 counties in our very large state, which I know is surprising to many. But we do have a sample across all 15 counties. It is a sample of convenience, so we don't do any random sampling. It is any school that agrees to participate does participate. And so you can see what our recent participation totals are. Obviously 2020, I don't think I need to explain why we saw a lower participation rate there. We do administer in the spring. So we start in January once kids get back from their winter break and go all the way through May. So right when the pandemic hit in 2020, perfect timing. So 2024, that 42,000 was right about, just to give you a sense of what our sample is compared to our population. That's right about 15% of Arizona students statewide. So a pretty good sample across the state. Next, Matt. Thank you. So the main focus of the survey itself is looking at the prevalence and frequency of substance use. We ask our students about their frequency and prevalence of use on over a dozen different categories of substances. So obviously marijuana, but we break that down by edibles, if they've smoked it, if they've vaped it. I mean, we break that kind of down. And then also alcohol, we ask about nicotine, we ask about opioids. So we ask about all prescription medication abuse, and then all the way down to our, more harder substances like methamphetamine and those kinds of things, cocaine. So we ask about pretty much any substance you could possibly think of. We ask about lifetime use, so if you've ever used it, and then also if you've used in the last 30 days. So we're getting a pretty good sense of this, of whether or not use is just kind of an experimental or if use is a habitual. And then we also ask some questions about where they're getting sources and how, what their perception is of the availability of sources. So perhaps even if they're not using the source, how they perceive how available it is around them. And then we also ask about attitudes of use. So how dangerous do they think specific sources or specific substances are? We also ask a lot about exposure to violence and victimization of violence. So we have several questions on have they witnessed violence either at school or in the community? Have they perpetrated violence either at school or in the community? And then also whether or not they've been a victim of violence. We also ask about boyfriend and girlfriend violence, so getting at some of that intimate partner violence at a younger age. So we're able to assess some of that information as well. Same thing for bullying, whether or not they've seen someone bullied on campus or in the community. And then again, if they have bullied someone else, and if they have been the victim of bullying. And then again, we ask whether that has been at school. We also ask, of course, whether they have been cyberbullied or have cyberbullied someone else. Within this, we also have a category about school safety. So we're asking about how safe they feel going to school, if they've ever skipped school because they have felt unsafe. We do also ask about handgun violence. I should have mentioned in that violence category, we're assessing whether or not they've witnessed handgun violence or experienced handgun violence in the community and then also at school as well. Next slide, Matt. So some other categories that we cover in the survey as well. We ask about almost all of the adverse childhood experiences that the CDC recognizes. The only one we don't really ask about is parental mental health. So we are asking about parental substance use, incarceration, divorce, parental domestic violence, and then if the child has experienced physical abuse, verbal abuse, or neglect. And so we are able to assess all of that. We also ask several questions about positive childhood experiences. So we have lots of questions about community involvement, after school activity involvement, supportive adult relationships, safe neighborhoods. So we're able to assess a lot of that information as well. We have risk and protective factors, although I will say we did a I think probably one of the most significant overhauls of the survey going into this year. So I think a lot of our risk and protective factors are going to change or have changed for 2026. But the risk and protective factors are personal environmental factors that influence the likelihood of engaging in problem behaviors. So there's peer, individual, family, school, and community risk factors that are based on the communities that care model. So we have a whole host of the risk factors that we assess in different scales. And then finally, just kind of wrapping all of that up, we do ask about several other kind of delinquent and risky behaviors, definitely cover gang involvement, gambling, theft, and then dangerous driving. So driving under the influence and then texting while driving. So next slide, Matt. You can see there is a ton of information that we are getting, and this is self-reported from students. And so obviously, I think the implications and applications for the results of this survey are far and wide. It definitely, from an academic perspective, our partners at Arizona State and their lab do a ton of work with this from a prevention and intervention perspective. It definitely provides data for the community for targeted prevention and intervention efforts for the boots on the ground. The research supports funding efforts for all of our stakeholders, so schools can use this data for grants. Substance awareness coalitions and other nonprofit agencies use this data for grants all the time. It assists in driving local decision making, and it does provide community level data because we are, collecting information at the zip code level, at the school level. So we are able to kind of drill down to the community level to know fairly precisely what's going on in your neighborhood, basically. Schools and districts can use this data to monitor trends within their schools, within their districts, to monitor trends, to measure effectiveness of interventions or programs that they have. So this data is fairly critical to some of our stakeholders throughout the state. So how do they get this data? We produce a state report, so that gives the information from a statewide perspective, and that is available to anyone, posted on our website if you're interested. We also have the 15 individual county reports that are available. So each county has their data broken out, compare counties to other counties to see what's going on in each of the counties. We produced several data snapshots for topics of specific interest: substance use, bullying, school safety, and those are available. Each school that participates in the survey and each district that participates in the survey gets customized reports. Those are not publicly available. We do protect the confidentiality of our schools and districts that participate. So those are given directly to those participating schools and districts, but they are able to see their customized specific data. We give multiple presentations to coalitions, any group really that asks for a presentation on the results. We will go and give any sort of presentation on the results that they're interested in. We also will provide raw data to researchers with obviously certain stipulations. Institutional review board review, and then a data sharing agreement. But academic researchers can really do a lot of work with this data, and we do get a lot of requests for that. But when it came to our other kind of partners, our community partners, our substance awareness coalitions, what we were getting is a lot of phone calls, a lot of emails. I work in this area of Phoenix with this community, and I would like to see, this data about, marijuana trends for the last 8 years. Can you guys help me? We have a data visualization center that Matt is going to talk about in just a minute. But if the data that they were looking for there was not easily accessible, it usually meant either Matt or I kind of walking them through how to break that down by the zip code that they needed, or if it wasn't there and readily available, the SAC then would have to do a data extraction. So we really wanted to be able to provide our stakeholders, and mainly our substance awareness coalitions, the ability to easily access the data that they need for the communities that they support without having to rely on the SAC to get that data. So I'm going to hand it over to Matt to talk about how we addressed that problem.
Thank you, Allison. For a second, hold on. I'm going to stop sharing. For whatever reason, my screen froze, but I think this is a good opportunity in case anybody does have any questions. George, thank you for the additional intro with my prior involvement with JIRN. I do want to say thank you to JIRN for this opportunity, and have always been very supportive of everything that we're able to do here, especially network to solve issues, solve problems that we're all experiencing each and every day in the great work that we're doing. So with that, I just want to open up if you have any questions for Dr. Horgan or anybody that wants to comment to the work that we're doing. I'm going to take the screen share down really quick.
Oh, it does look like George had a question. Yes, on our data visualization center, I know it says I did answer your question, but on our data visualization center, you are able to break the data down by zip code, which I'm sure Matt is going to demonstrate. But there is still some data of interest to our coalitions that is not available currently on our data visualization center.
Thank you, Dr. Horgan. I have another question. How does this survey kind of coincide, or not coincide, but jive with, does Arizona do a youth risk behavioral health survey as well? And like what's the overlap like on this?
Yeah, so the Department of Health Services here in Arizona does, they're responsible for the CDC's Youth Risk Behavior Survey, and we do work very closely with them. They do their survey on the odd year, so we kind of consider ourselves sister surveys. We have a lot of questions that we are very much in line with, so that we are able to look at our data very closely, because it's so closely aligned, we can kind of map our trends over time with them as well. But that way we're not suffering from survey fatigue for our schools. So they have the opportunity to do the YRBS on odd years and the AYS on even years.
Oh, hi, this is Allison Rosenthal from Colorado. I was just wondering about what your recruitment is like compared to YRBS, and if you've had increased challenges given the political climate around schools. We've just been encountering that in Colorado.
That is an excellent question, Allison. Arizona had, I don't know, maybe what, 3 or 4 years back now, Matt, went through some legislation with school surveys specifically requiring parental consent for all school surveys. And so active consent is required for school surveys. The AYS was granted passive consent because it is administered by ACJC through the legislation. And so we have been very lucky to still be able to be administered with a passive consent process. The YRBS, because of the nature of some of the questions that they ask, does require active parental consent. And so their recruitment has suffered over the last few years because of that. The downside is we are limited in terms of the questions, the types of questions that we are able to ask on our survey. So it's a, cost benefit, balance of what we would like to ask versus what we are able to ask, so that we can continue to operate under that passive consent. But yes, we have definitely experienced some of those same issues here in Arizona as well.
Just to add to that, I think the value that the survey brings to the community, especially with answering various questions when they're applying for grants, like you had mentioned earlier, Allison, that we continue to provide the value for their programming out in the communities. And with such a large sample size, it has been valuable to those communities. If we didn't have the value there with such a large sample size, I'm not sure we would continue to gain that steam towards 40, 50,000 students responding like we have. But I think it's the champions out in the community that really drive the interest moving forward with the survey, each and every administration. And so we've had a really strong backing from our stakeholders across Arizona, which has helped. Any other questions about the survey side? No? Okay, hopefully everybody can see the screen here, the Data Visualization Center. I'm hoping as my slides move through, they move through with you. So let me know, Allison, if you don't see certain parts that I'm referencing, and then I'll make sure that we get that up on the screen. As I mentioned earlier, I think this type of brown bag experience is really, let's bring something to you to take home, to bring back to your agencies, to bring back to the work that you do. So we're going to peek under the hood a little bit here and talk more about how we've implemented this here at the agency, how we're moving forward with finalizing this dashboard. And we anticipate getting this out to all of our stakeholders by mid to late September is what we're anticipating, getting it out to everybody. We faced some internal issues. We had a former business intelligence analyst here at the agency who is no longer here. So we had a little bit of a delay in getting this out to all of our stakeholders. But we're very hopeful that this gets out at a perfect time. We're in that odd year of administration. So we're always looking for ways to enhance the information that we get out for 24 and prior administrations. So this is a good opportunity to just refresh the minds of our users and give them the tools that they need to go out and engage again with the schools, with the districts, with the communities that they live in, to provide that level of information that they need for better programming and better decisions. This is the conventional Data Visualization Center for AYS information. This is pretty much the layout we've had for a number of years. We may have presented this to all of you at JIRN a few years back and walked through some of the detail about it. But what we have up there right now is approximately 70% of all the data that we have available through the survey, looking at substance use, attitudes, risk and protective factors, all that wealth of information, as Allison had mentioned earlier, available here for query. There's even on the left side at the bottom, you can see it's like a data spreadsheet of information that they can query specific zip code level data. They can query specific demographics and really drill down to their area where maybe they can't necessarily do that as well with the dashboard that you see on the right side. So we've tried to resolve a lot of our internal concerns about getting the access to the data for all of our requesters of that information. Typically, it took weeks, possibly a month, to get that data out to each and every requester of that information. Now we can do it in seconds if they just go to the website and gain access to that 70–80% of the information that they're looking for. So this has really helped us streamline our efforts at the agency and be able to focus more on the work that we need to do to enhance the product that continues to go out. But I do want to say, take a mental note of that dashboard on the right side. We're migrating away from that format and looking more towards a mobile-friendly version in Tableau. So for those of you that work in Tableau, maybe work in Power BI, what we found is Tableau is not as mobile-friendly, especially when you're working in the stories environment with this type of layout that you see here for a dashboard. So we've done a more vertical approach with this dashboard, and you'll see a little bit of what I'm talking about here moving forward. But just keep that in mind as we're walking through. Okay, so these are conventionally the categories that we have in our dashboards: substance use, attitudes, factors, everything broken down here: lifetime substance use, 30-day, age of first use, substances offered, sources of substances. Those are consistent with what we're going to try to offer to our substance awareness coalitions through that dashboard. And then attitudes, access to substances is one in particular that I know many are looking at, along with reasons for using or not using, disapproval and perception of harm from use of substances. And then the risk and protective factors at the bottom, along with some additional resistance strategies that we monitor, ATOD conversations, so alcohol, tobacco, and other drugs, non-ATOD conversations that they're having with parents and adults, and then interactions at the school. That's conventionally what we have on our dashboards currently. Just wanted to bounce over to this really quick. We do offer maps on those dashboards. However, you can see how complicated it might get. You need to search the map or click on certain options for zip codes. If you have multiple zip codes, really the best option that you have is the data sheet tab at the end that I was showing, with a lot more tabular information for the agencies. You have to go through a drop down and select out every single zip code that you want. So if you're a substance awareness coalition that has 10, 15 zip codes that you serve, you have to go through that list and checkbox every single one of those. That can be a tedious task every time you want to come back and find the data that you're looking for. So we kept that in mind when building the coalitions dashboard. One click, let's give them one click, maybe two, to get to exactly what they're looking for. Make this really easy for those coalitions to access that information. And we've enhanced our approach to what we offer. Substance use categories are pretty standard issue. This is what we wanted to provide. This is what the coalitions were asking for looking at 30-day substance use, age of first use, where substances were obtained, reasons for using, reasons for not using certain substances. But we also added in the ACEs information that we've refined over the past administration or two to really align with the ACEs consortium here in Arizona and align with the metrics that they're capturing also through YRBS. So there's ways that we can better align with the other agencies, with the other organizations that are out there monitoring this information. Let's do it. We're looking at ways to continue to do that within the survey. Where that's why we're providing the ACEs here, is because the coalitions are looking for that type of information. Risk protective factors are always of interest to our stakeholders. So we're factoring that into the dashboard as well, the Substance Awareness Coalition's dashboard. And then we're also adding indicators that we don't currently have on our website, bullying and cyberbullying, and then also looking at dangerous driving habits amongst youth. And again, if you have any questions or anything, please do stop. I'm more than happy to answer those questions as we're walking through. So this is the start of the Substance Awareness Coalition's dashboard. At the very top, and like I said, we use Tableau. We have Tableau Public, where we publish these, and it's free of charge. It's a really nice opportunity to get that information at a reasonable cost to everyone online and make this available via the public. But what we wanted to do is really target this obviously to the coalitions and give them a map where they can easily find their location. Click on their coalition, the pinpoint that's available there on the map. I didn't realize how complicated pinpoints are in Tableau. Literally the pinpoint, if you were to create one, Tableau usually has like a circle design. It's just a circle in the middle point of your data point. When we're building out some type of custom look, and so a pinpoint, I created that from scratch. You have to offset it where the bottom of the pinpoint is hitting the middle of that data point that it's identifying. Otherwise, it might be off, a few blocks or wherever the case might be in your map. And so we've done little bits here and there trying to customize the way that these pinpoints are laid out so they are as accurate to the map as possible. But even to that level, that degree, there was some technical aspect that we had to approach that issue. Once they click on one of those pinpoints or their specific coalition, they'll see below that the map of all of the zip codes that are associated with that coalition. So they provide us their zip codes that they serve, and then we assign the data accordingly per that specific coalition and the area that they serve, and encompass all of those zip codes together upon that one click on the pinpoint. We'll talk about it in a second, the PDF click that they have to download their data into an appropriate PDF document that they can take with them and bring that to their meetings, bring that to the schools, the districts, to talk about the data that's going on within their communities. So once that pinpoint is selected, then we're starting that entire vertical of all of the data available. So again, like I mentioned, it's not laid out as we have for our prior dashboards that we have available for AYS. We're looking again at being more mobile. This was per the guidance of the governor's office here in Arizona, is make it easily accessible so that it's easily readable on the screen, easily navigable. That's really important for our users, but also that mobile friendly option, because everybody's moving at the speed of light now. They need that information, that data available to them in a remote fashion, no matter where they're at, not have to get back to their laptop or get back to their device at work to figure out exactly what's going on within their communities. So we're providing a more vertical approach. We're abandoning, in a sense, the story layout that we had earlier to accomplish that task. The stories just don't give us the mobile friendly version that we want and that I think the state wants to adopt here in Arizona. So as you can see, we start out with 30-day substance use by grade. We follow that with the top 5 sources of substances. So we go from a full breadth of all of the substances that are monitored to really their top 5. Let's get at what's important within your community. Next up, we offer age of first substance use, broken down by 8th grade, 10th grade, 12th grade. A lot of this data is broken down by grade, just so that we're able to better digest that information depending on the prevention work that you're doing within the community. And then reported reasons for substance use. We list the top 5, or I believe it's top 5 on that one too. We might want to refine that title there to reflect it. But those top reasons for using these specific substances in 24. And I think this is really where a lot of our users are going to start gravitating towards the ACEs information. They want to know more about their community level ACEs that are occurring amongst youth within that community, that specific community, and seeing it broken down here. This is really important that we get this information out. We're looking at another dashboard that will focus specifically on ACEs, but I think getting this out to our coalitions, who are really the ones that are most interested in gaining access to that information, getting it out to them quickly through this dashboard will be really helpful, along with looking at the risk and protective factors that exist within their community. So high risk. Also, I didn't include it here because it's just an additional option. Just below this is the protective factor information, but same concept as what we see here for the risk factors. And then we follow that up with some additional information that the coalition specifically wanted to target, bullying and cyberbullying. And we asked both those components in our survey. And then dangerous driving habits that occur amongst the youth. So we have obviously driving while using alcohol, using marijuana while driving, and then also texting and driving. The texting and driving has been a specific focus of the coalitions as well. So all 3 of those are put together to understand the impact, the magnitude to the community that they're experiencing. Now, on top of that, I mentioned the PDF click feature. This is, I think, something that's going to be really valuable for those coalitions when they're desiring to not only look at the dashboard, but to bring that information directly to their meetings, bring it to the schools, to really sit down and talk about these issues. So this was a particular effort. Tableau is not friendly, I think, with the PDF layout. So what we decided to do is move forward with kind of brush the dust off of using crystal reports, SAP crystal reports, to quickly just churn out these reports in a fashion that makes sense for that digestion of information. So we leverage crystal reports to create the templates. And at this point, we have a template built for all of the similar data that we have on the dashboard to be produced into these PDF reports for each of the coalitions participating. We have over 50 coalitions within the state. So to manually put together these reports would be a monumental task. I'm sure I'd hear from Allison, like, what are you doing to me? What are you putting on my plate here with my team? Let's make this an automated process. So crystal reports made sense for us. I'm not sure if anybody else is using crystal reports for other purposes and putting together your automated reports. But it still is really relevant for us here at the agency to accomplish this task. So within seconds, we can have all 50 of those reports produced now that the template's available. Really, it's just getting the data into the right spot, and we've really streamlined that process as well. So these reports are available just by that PDF click at the top of the dashboard for them to download the specific coalition that they identified in the map. And that report is basically laid out very similarly, although we include the full breadth of the data for 24. So looking at substance use across all of the substances where they had a drop down, they could select out the substance that they wanted to pick from. Here it's a little bit more static, right? So we need to provide them basically the universe of the data that they're looking for within this report. So again, we have the substance use information, we have age of first use, we have sources of substances on the second page, also including the ACEs information there. And then on to a third and fourth page. That again just reiterates a lot of that information specific towards their profile for their coalition. And I took away the coalition name on this one just since we're still in our test beta mode for release. But this is basically some test information, some test data that is laid out for that single coalition. So their name would be at the top as the profile for X coalition, and then their specific data and information listed there. Risk protective factors, bullying and cyberbullying, and then dangerous and distracted driving. So really the combination of Tableau features along with automated reporting capability through Crystal reports, we're bringing that tech together so that we can easily resolve these issues that coalitions have with getting the right information, and then also bringing that to their meetings, their brainstorming sessions, whatever the case might be, to talk about programming, talk about the issues that they're facing and things like that. So again, as we've been talking, the Substance Awareness Coalition's dashboard is going to be released here in September. We're also looking at the ACEs dashboard to follow that and complement with that. And then we've been working with ASU on a weighted report. We do work with a convenience sample across the state of schools and districts that seek to participate in the survey. While we do have a large sample size, we also want to recognize that there may be some complications with that as far as being valid and reliable for that survey across the state. So we're looking at weighting the sample to improve that the quality of the data that we're seeing on our end, and the basically what we're reporting out to see, are we in the right ballpark with what we've been reporting out in our statewide and county samples. So looking at working forward on that project, hopefully by October, November, we anticipate having a report to release, but we're still working with ASU on final deliverables on that. And here's our contact information if you have any questions or would like to walk through some more technical aspects of what we're doing here with the AYS data. We're more than happy. Allison and I are available anytime to have those discussions. And again, any questions or concerns that you have, we'd love to talk about it here today if you have any of those additional questions available to us.
Hey, Matt, I have a question.
Yeah,
This
sure.
is George Shaler. So I really like the coalition charts that you had just a couple slides back. I'm just wondering if I'm a coalition and I am interested in low, or let's just say alcohol use.
Okay.
Is there a quick way to see how my coalition area compares to the state? Like, so if I see like, it's, 25%,
Right.
do I have to go back and kind of get the statewide report, or is there a way of like showing like statewide averages along with the coalition's dashboard?
It's a great point, George, and one that we can always refine and continue to improve upon the dashboard. We can absolutely add that in if they see that value. And I think you're right, there is that value to bring that comparison to understand where they fall within the state. So at the moment, though, yes, they would have to jump back to the other dashboard to review that. But
and I don't mean for a moment to take away from this, because it's an incredibly useful tool.
Mhm.
I'm always like it was just something I was thinking about. So I really like that tool, and it's I think it's really helpful to look at the 3 grade breakdown as well to kind of see where the trajectory is going with a particular issue. So thank you, and well done.
Thank you, George. And I think that's a value add for sure to put in that statewide perspective as well. Just out of curiosity, anybody using Tableau currently, and what are your experiences with using Tableau, Power BI? Any limitations or issues that you're experiencing? Allison?
This is Allison again. I think the biggest limitation we have is with accessibility in Tableau. It's not easy to make patterns to differentiate different values. And so you're kind of relying on color alone, which is a tough. And yeah, and I just wish it was, we have like strict requirements in the state of Colorado about accessibility of our like information. And so it's been really hard to adapt.
Yeah, Allison, thanks for mentioning that. We're experiencing the same pain in the growth process. I know they're coming out with guidance, further guidance. They had initial guidance for how we would make, dashboards and everything more accessible, more streamlined throughout the state. But I think they're really starting to look at a very standardized approach for all of the agencies. I am not sure where we fall in line with that standard. And so I think we're going to have to start revisiting how we design these dashboards. One in particular I know that they were looking for is that more vertical design to make it more user-friendly, more mobile-friendly, more accessible. This is easier to look at sometimes than the dashboards that we have with, there's vizzes all over the place, right? There's 4 or 5 just in that screen shot that you have in front of you. But here, if you can kind of scroll through it and it, the story makes sense as you're going through it. That's basically what the governor's office, I think, is going to start coming out with as far as that standardized approach. So we're trying to navigate that as well here within Arizona. I was also curious, since we have fellow colleagues in the room, anybody still use Crystal reports? I might take that as a no. All right. I was curious because we implemented it. George, go ahead. Oh, you do use it. Okay. We implemented it, I want to say back in 2017, maybe 2018. And I just figured, maybe things will develop that might phase this out. But it actually turned out to be a pretty decent tool for our purposes here with regard to this report. And we might be able to leverage it for others. Although I know we use, Canva and other suites of product to make it more visually pleasing or aesthetically pleasing and consumable for all of our stakeholders. But George, did you want to speak to that?
Yeah, I did. And Matt, I'm just this is not related to the question you just posed, but I'm just curious. I mean, one of the things that we're seeing at the federal level is some pushback by certain organizations about data. And I'm just curious if that has trickled down to like Arizona. Like, are people pushing back at times on these data that you're presenting in your dashboards and reports, because it's now kind of an opportune time to kind of tackle or dispute data?
Yeah, that's a really good question, George. And Allison, you can interrupt if I'm going too far on a tangent with this one. But I think the luxury of AYS is the data are really valuable no matter which side you fall on certain issues, no matter, we all care about the safety and security of our youth within the state. So I think the AYS has been a particular area of interest, where we've seen that desire to have data readily available. We haven't heard concern about providing this data online. We have a threshold of 25 or greater for release of that information. So our threshold is rather high. I think for the YRBS, it's more around 11 or greater in the state of Arizona. So we've adopted a threshold that I think we're all comfortable with releasing that aggregate level information at the 25 or greater point. And we take very seriously the confidentiality of the schools and the districts. We don't in any way try to make available any school or district level information. It's zip code level, it's county level. So we're trying to be as respectful as we can to the providers of the data and adhere to those standards. Beyond that, most of what we put on our website is program based. So it's performance measurement for other programs here at the agency. We're not looking to provide information that, let's say, corrections already has on their website, or AOC might be looking to prop up on their website. We'll point in their direction to get them there. But I think particularly looking at the data that we handle here at the agency, it's been by and large pretty well accepted by the stakeholders that we make that available. And I have not heard really any concern at this point. I don't know, Allison, if you have a different take on that, but.
No, I think we've so far been relatively unscathed. I think, yeah, Matt's dead on when he says the data that we're looking at is important to everyone, no matter which side of the aisle you fall on. So I think so far, we haven't received any pushback.
Any other questions or comments? Okay. I do again want to take, and Allison, I don't know if you wanted to do a final farewell with me, and thank you to JIRN for everything that you've provided to us today. We really do appreciate it. Always great work that the SACs and the research teams are doing across the entire country. So we do appreciate the opportunity to just give a little peek into what we're doing out here in Arizona for a little bit.
Yes, thank you.